a Year 5 student. He's talented about the topics he loves, especially trains and maps. He has a strong visual memory and notices patterns that others miss. Luca is also autistic, meeting the criteria of autism spectrum disorder level 2, which means he benefits from consistent support for social communication and for managing sensory input and change. My starting point is to assume competence and adopt a strengths-based approach. Luca is a capable learner whose success depends on how well we design the environment, the teaching, and the assessment. By inclusion education, I'm using a definition that frames inclusion as the right to attend a neighborhood school with individualized differentiation to support physical, academic, social, and emotional access, and participation in the same curriculum as peers. This aligns with the social model of disability. The primary barriers are in the environment, attitudes and systems, not in the child. The alternative is a medical model of disability, which treats difference as the fixed to be fixed. In practice, medical model thinking can slide into othering, position students as not normal, and can fuel ableism and gatekeeping. While entry to mainstream classes is restricted unless a child first proves they will fit a preset mold. Our commitment in this address is to design so that Luca can learn on the same basis as his peers. Before the 1970s, most children with disabilities were entirely excluded or taught in separate special schools. In the 1970s to 1980s, policy shifted from segregation to integration, allowing students with disabilities into mainstream school, but often with minimal adjustment. Since the 1990s, after the 1994 Salmon's statement, Australia has moved toward full inclusion, where students with disabilities learn alongside peers with necessary support and adjustment. From a legal perspective, the Universal Declaration of Human Rights proclaims that everyone has a right to equal access to education, and that all persons are free and compulsory to receive primary education. Furthermore, the Convention on the Rights of Persons with Disabilities mandates the establishment of inclusive education system and the provision of reasonable accommodation for persons with disabilities, enabling students with disabilities to participate equally in education process. The Convention on the Rights of the Children asserts that education constitutes an inherent dignity and an inalienable right of renders discrimination against people with disability unlawful. While the Center for Education of Persons with Disabilities explicitly mandates that schools must provide students with disabilities with equivalent access and participation conditions to those afforded to students without disabilities. Regarding social justice, Australia's national education goals have long articulated that schooling should embody social justice, meaning no child's potential should be constrained by factors such as disability. If we include him in the class, we are not just upholding his right to equality, we are also showing that our school is fair and just for every student. On paper, a separate unit can sound supportive. In practice, it often causes othering, ableism, and institutionalized gatekeeping. It asks children to leave their peers and the culture to access support. The conflicts with the human rights instruments I just mentioned, and with the principle that participation should be on the same basis. What's more, the Australia Human Rights Commission argued that inclusion must be system-wide, such as leadership, relationship with families, student surveys, and built environment. Closing the unit does not mean withdrawing support. It means relocating expertise into mainstream classrooms, building universal design for learning into the core program, and reserving separate space for short purposeful interventions that feed back into class rather than serving as a parallel schooling. The Disability Standard for Education spells out a continuous circle, consult, decide on adjustment, implement, and review. A separate unit often breaks that circle by shifting responsibilities away from the classroom teacher. This is also a social justice issue. Equality gives everyone the same thing. Equality gives each student what they would need to reach the same outcome. The fair selection cartoon, everyone must climb the same train, expose how a one-size approach advantages some and excludes others. For Luca, inclusion protects his right to learn with his friends in the same shared life of school. It lets us map his strengths to the curriculum. His passion for maps becomes a data visualization task in geography. His eyes for pattern becomes a mathematics investigation. It supports his social goals when support group roles are explicit and valued. Inclusion also honors the dignity of risk. Learning involves trying, failing productively, and trying again. For his parent, inclusion means being respected as experts in Luca's history and preference, and it means genuine partnership. We understand that parents may have concerns, whether it's Luca's parents or other parents. However, inclusion education, when done right, is a win-win for families. If you are the partner of children with a disability, you will find that your children learn important values by having classmates of different abilities. They learn empathy, patience, and how to include others. Parents of children with disabilities are able to see their children accepted in the community, gaining confidence and reaching their potential in a regular classroom. For teachers, a universal design of a learning approach reduces the needs for many one-to-one adjustments because access is baked into instruction. With training and resources, teachers report increased tolerance and understanding, and a positive outcome for all students in an inclusive setting. School must support teachers through professional development and specialist assistance, but ultimately, teachers play a key role in modeling inclusion and creating an environment where every student can succeed. Classmates without disabilities also benefit from inclusive education. They learn leadership, compassion, and how to work with people of all abilities, invaluable social skills. ASD is a development condition that affects how a person communicates and relates to others, as well as how they experience to the world around them. Individuals with autism often have difficulties with social interaction and communication. For example, they may misunderstand social cues or struggle to hold conversation in typical ways. Many are very reliant on routines and can be highly sensitive to changes in their environment. Sensory sensitivities are common. Luca's autism presents a few barriers to learning in a traditional classrooms. Luca sometimes has a hard time with the back and forth of talking and interacting with people. He might not make eye contact steadily. Luca really likes routines. He finds comfort when the school day follows a predictable pattern. When something unexpected happens, it can be unsettling for him. He might get anxious or upset. The sensory sensitivities of ASD are primarily characteristic by abnormal response, either hypersensitivity or hyposensitivity to one or more types of sensory stimuli, and this response interferes with daily activities and function. Repetitive behaviors or special interest in ASD refer to core features including repetitive, stereotyped actions, and narrow, abnormally intense interests. I will organize this with you, universal design for learning, then connect them to our legal duty to make reasonable adjustments. Engagement, we can offer meaningful choices and link tasks to interests. For a persuasive writing unit, one topic option can be transport planning, tapping Luca's motivation. Provide a clean visual schedule so change is signposted. Build short movement breaks between segments. These strategies raise engagement for many students, not only Luca. Representation. Present key information in multiple ways. Combine brief teacher talk with visual and apply English online. Provide worked examples and sentence starters. Use visual timer and the color code steps. These are reasonable adjustments that support access without changing the curriculum standard. Keep the learning intention and the success criteria constant, but allow alternative products. For example, a history explanation can be a 2-minute audio with images, a label diagram, or a transition paragraph, assessed against the same rubric. Scaffold group work with assigned roles and scripts for initiating contributions. If a parent says, I'm worried that Luca needs will override the needs of other child, my short answer is inclusive education is not a zero-sum game. Supporting Luca does not mean we give less to others. In an inclusive classroom, we use strategies that allow the teacher to give attention to different students at different times, as needed, without anyone being left behind. For example, I build lessons with clear routines, visual support, and multiple ways to assess information that helps every child stay organized and engaged. I also teach patience, empathy, and teamwork explicitly so students learn to support one another.